Hello guys, welcome to our new video. Today we will discuss about different types of adverse drug reaction. These are classified into several types based on their predictability and relationship to dosage. Type A or augmented reaction are dosage dependent and predictable, while type B or bizarre are unpredictable idiosyncratic reaction. Other types include chronic, delayed, end of use, and failure. Here, type A or augmented adverse reaction is dose related. These are common, predictable, and related to drugs pharmacology. Example, bleeding with anticoagulants, sedation with antihistamine, etc. Type B or bizarre is idiosyncratic drug reaction. It is rare, unpredictable, and not dose dependent. These often involve allergic reactions such as anaphylaxis, rashes, or genetic intolerance. Type C or chronic adverse drug reactions are characterized by their association with prolonged long-term use and high cumulative dose of the medication. These reactions develop gradually over time and may persist for a long period. This adverse drug reaction is due to structural or metabolic changes in the body induced by sustained drug presence, such as functional adrenal atrophy. Examples of type C reactions include adrenal suppression due to the use of steroids, osteonecrosis of the jaw, avascular necrosis of the hip, Cushing's syndrome. Here, chronic administration of corticosteroids causes suppression of hypothalamic pituitary adrenal axis, leading to atrophy and insufficiency. In case of osteonecrosis of jaw, it is associated with the long-term use of bisphosphonates. Avascular necrosis of the hip is another consequence of long-term corticosteroid therapy. Another example is analgesic nephropathy. It is a kidney damage arising from the years of use of pain medications. Cushing's syndrome is often as a result of chronic high dose of prednisolone use. Type D adverse drug reactions are rare, time-related effect that appears months or years after treatment, sometimes even after drug is stopped. They are often not dose dependent and it includes serious outcomes such as carcinogenicity and teratogenicity as well as infertility. Type E adverse drug reaction is also known as end of use or withdrawal reaction. It occurs shortly after stopping or reducing the dosage of medication that has been used, often long term. These reactions represent a physical dependence or an adaptive state where the body requires the drug to maintain normal function. Common examples of type E reactions are rebound hypertension, benzodiazepine withdrawal, opioid withdrawal, adrenocortical insufficiency, withdrawal seizures. Rebound hypertension occurs after abrupt cessation of antihypertensive agents such as beta blockers like propranolol, clonidine or methyl-dopa. Withdrawal symptoms like insomnia, anxiety and tremors after stopping benzodiazepines like alprazolam and diazepam. Nausea, vomiting, sweating and restlessness after stopping opioid medications. In conclusion, abrupt withdrawal of certain agents, particularly those that can act on central nervous system or autonomous nervous system, can trigger a surge in sympathetic activity. For example, rebound hypertension is driven by a sudden increase in catecholamine and upregulation of receptors that were previously blocked by medication. Type F adverse drug reaction refers to an unexpected failure of therapy, often characterized by a common dose-related reduction or loss of the drug's desired therapeutic effect. Unlike toxic side effect, type F reaction occurs when the medicine does not work as intended. In type F adverse drug reaction, the failures are frequently triggered by drug-drug interaction, drug resistance like antimicrobial resistance, or factors affecting metabolism such as poor metabolic conversion.